Someone who's a candidate for cochlear implants is someone who has worn hearing aids for a long time. They've been appropriately fit with hearing aids, and maybe they're not hearing as well and they're not benefiting from them any longer. So our process with cochlear implants, if someone thinks they may be a candidate, we recommend that they come in for a current hearing test and see one of our providers first. We then would determine if they've worn hearing aids. We would check to see if maybe they need new hearing aids first, current updated technology, to see if they're appropriately fit, make sure that they're getting the most benefit they can from the hearing aid.
And then I'll see them go over their hearing, discuss their ear history, do a complete head and neck exam as well as a medical exam to see, one, if that's something that's a reasonable evaluation for them, and basically talk about the implant and talk about what's involved from a surgical perspective or rehabilitation perspective and what they can expect moving forward with this, because it's a big decision to move forward with a cochlear implant. I think that for a lot of patients it's a fantastic decision, but I always like to make sure that everyone's on board. After seeing me, the patients will go through a cochlear implant evaluation, and that's a specific type of audiologic test with our audiologists.
That is different from the hearing test in that we actually do testing with the hearing aids on to see how patients are performing with the hearing aids. Then there's certain criteria that we have to determine.
That not only allows us to identify patients who are cochlear implant candidates, but it also allows us to work with insurance to get the cochlear implant covered. After the cochlear implant evaluation, then I'll sit down with the patient and basically go over everything from top to bottom and make sure that we have all of our ducks in a row and talk about the risks, benefits, expectations, and have just a discussion with the patient about what they want to do. The surgery itself is something that can be approximately two and a half hours. We allow patients to heal up for approximately 3 weeks.
There's a post-op where they see the surgeon, make sure everything is going well and they're healing well. Once they give us the clearance, then the patient has an activation appointment where they receive the device, they get the sound for the first time. With that, it is a process as well because things are changing, the brain is adjusting to the sound. We see the patients then about a couple weeks afterwards, then about a month, then about 3 months, 6 months from the initial activation, and then a year, because again, things are changing. There's a lot of different things happening and a lot of things to talk about and review. So it is a process. It's a team environment where we all work together to help the patient, but the patient also, the more work they put in, the more benefit they're gonna get.